Great having you guys here and appreciate the opportunity for presenting. I'm actually going to be presenting a shared screen. I'm not sure how many of you have experience treating with instrument-assisted soft tissue mobilization, or we call it IASTM here. Graston is a renowned and worldwide accepted instrument-assisted soft tissue mobilization vendor. They are the first one who came out with this. And right now we have probably 3 or 4 more companies which promote this at this time. So I will be mainly talking about Rock Blades. This is another company, as well as Graston Technique. Give me just a second. I'm actually going to be sharing a PowerPoint presentation. Okay, looks like I'm back on. I am sorry about the technical difficulties at this time. Right?
Sir, is the problem resolved?
Yep, looks like we're back on. Thank you.
Okay, thank you, sir.
Okay. All right, so instrument-assisted soft tissue mobilization, otherwise we call it the IASTM, has been around for many years at this time. And it actually originated in China, where it is called as gua sha, and became more popular in the US. At least in the past 10 years, it's been very popular in the US. It's one of the most commonly used way of doing myofascial release or glide at this time. The fascial system, the skin of the fascial system has a very high density of sensory receptors than any other connective tissue in the body. So the skin, this fascial system is spread all over our body. A lot of people don't know about this. So I will be showing you a video about how we can change the fascial system to improve your movements. These are some of the commonly used instruments. On the left side, you can see the Graston, and then we have the Rock Blades. The first one is the most commonly used one, and they are pretty expensive to invest. The second one, the Rock Blades, they are much cheaper to use, but they also have limitations. All right. So one of the things you can do the next time you see a patient who does have some limitation, take a spoon, put your thumb right on the spoon, and try to gently glide, and see if you can feel any adhesions. Most of the time you would feel some bumping. So you'd feel that you would feel it more through the spoon versus your thumb of your hand. It's because it transmits those waves through your hand. That's how you find out there are adhesions. A lot of people still say, oh, I want to do a myofascial release. It's actually glide. So Dr. Robert Schlepp, he did a research and concluded that plastic changes to the fascial anatomy by moderate loading is impossible to conceive. It's almost impossible to release the myofascial system, but you can glide the myofascia. So it'll take roughly 2,000 pounds per square inch to deform or release a fascia. So we don't have 2,000 pounds. So the system of IASTM works under the theory of restoring fascial gliding, and that's how it works. Okay, so what are we treating then? The whole nervous system is the most important target for influencing posture and movement. This is something Feldenkrais stated a while ago. Rolf said fascia is the most important tissue for posture and movement. Both are correct, and affected by IASTM. So the fascial chains provides an explanation of how the body moves, and the whole body myofascial integrated system is affected by how we move, or how we move is affected by how the fascial chain moves. So if your fascia is really tight or restricted, you may not be able to move as much, even though your shoulder, hip, knee, or any other joints can move freely. The theory of the myofascial meridians help manual and movement practitioners explore how one structure affects the other distant structures of the body. Okay, so let's do a quick experiment. This is a video which I recorded at our clinic. And before I get into that, you can see how the fascial system goes all the way from the bottom of the foot to the top of the skull. All right, here we go. So we have Greg here. He has some difficulty bending forward, and I'm going to demonstrate how the instrument-assisted soft tissue mobilization can improve someone's mobility within a matter of minutes. Let's take a look, shall we? Greg, just for the demonstration purpose, would you mind showing how far you can bend forward? Okay. All right. Does it feel a little tight here? Yep. Good. All right, so let's do a few. I'm using an emollient to improve the glide when I'm using the tool. I have my thumb right about here, so I can actually feel if there's any adhesions, which is something what we call scanning. And this is a technically called fanning, F-A-N-N-I-N-G. Going around the scapula a little bit. And on this side too. And around the spine, going around, right about that fascial chain. You can also see how the skin has changed the color, which is a normal erythemic reaction. There's nothing to be alarmed about. You should tell the patient that this is something to be expected. All right, now let's see how much bending Greg has. Greg, go ahead and bend forward. And you can see that almost immediately his range improves. Good. All right. Now, should the patient expect any discomfort with this? Should slight discomfort is possible, but it shouldn't be anything more than slight. Are you feeling anything? No. All right, let's give that a try again. Very good, very good. So it looks like we did improve his range of motion. I only felt it in my hamstrings, I think. Okay. So it's a great demonstration of how instrument-assisted soft tissue mobilization can improve the fascial mobility, which in turn will improve someone's ability to bend or reach up or any of that movements. Thank you, Rob. Appreciate it. All right. So from that quick experiment, I hope you watched how much. So what I did was I released the fascia. I did not change anything in the spine, even though I'm a spine therapist. I could have done a manipulation. I could have done released or mobilized facets. I didn't do any of that. So just by releasing the fascia, that's something a lot of us forget how to do that, because the human body is so amazing. Every day you explore new things. You don't need any fancy equipment. You can actually release the fascia with a simple spoon or a blunt knife, if you wish. All right, so let's get. So where you think it is, it ain't. So it's Ida Rolf stated this years back. So if there's a problem in the angle, so let's say you have a patient with post-surgical stiffness in that angle, and your angle dorsiflexion is so limited, instead of treating the angle, so you actually treat, so it's a ripple effect. Your calf, shin, hamstrings, these are the areas which you release to improve the angle range of motion, because it's a ripple effect. So you can even start from your lumbar, behind your hamstrings, going all the way to calf. So releasing those fascia actually improves your ankle mobility. Let's take a look at the shoulder. Someone with a lot of shoulder restriction, let's say a frozen shoulder or adhesive capsulitis. The ripple would be mid-back, lateralis, or pecs. All these areas are responsible for your shoulder to be mobile or immobile. So again, ripple, arm, forearm, hand. So to treat a shoulder joint, you may have to treat fascia in other sites, like your elbow, other areas. Yeah. What are the indications of the IASTM? Limited motion, range of motion, painful motion, poor motor patterns or dysfunction, decreased tissue glide. IASTM is just a technique. It's not a treatment system which can treat everything. No. If you have soft tissue mobilization, if you have soft tissue restriction, this is a great technique which will work instantly. How does it help? It helps break down the collagen crosslinks, facilitates changes in chronic muscle holding pattern. Let's say you have somebody who's coming out of a plastic cast and your quadriceps is so tight it won't change. This is a great technique. You can work on changing the muscle's holding pattern, or some muscle which has been in a chronic state of spasm. Next, increases cellular activity in the area, which includes fibroblast and mast cells. Helps scar tissue breakdown. Someone with a post-surgical scar, someone with a hip or shoulder or knee, releasing the scar does amazing changes in the patient's range of motion, even though the surgery was in a knee or a shoulder. The application of IASTM is used to scrape or break down the abnormal tissue and create minor inflammation to further promote the proliferation of new cells to create fresh and healthy tissue. Sometimes using the IASTM can create a localized inflammation, and when that localized inflammation heals, it heals that whole area. So thus, helping to bring down the pain, which is a symptom of inflammation. All right. What are some of the common conditions which could be benefited from IASTM? Achilles tendinosis or tendinitis, carpal tunnel syndrome, cervical sprain or strain. Fibromyalgia is a very commonly seen diagnosis at my clinic, and we often use IASTM to release adhesions. Lateral epicondylitis works very well, or medial epicondylitis. Lumbar sprain or strain, patellofemoral syndrome, plantar fasciitis is something which works very well. Rotator cuff tendinosis or itis, scar tissue of any kind of post-surgical scar. Shin splints, trigger finger, or someone with myofascial trigger points works very well. Women's health, post-mastectomy and cesarean scarring. One thing which I didn't list in here is a nerve entrapment. If any of you had McKinsey training, McKinsey commonly used this term as adherent nerve root, or ANR. So adherent nerve root could be very well treated using IASTM, and I'll show you a video how to do that. Contraindications: compromised tissue integrity, wounds, infection, tumor. These are things you don't want to use IASTM for. Active implants, a defibrillator, pacemaker, a PICC line, a pump, DVTs, inability to communicate. Let's say if you have a patient who cannot speak or who is mentally impaired and you're doing IASTM and the patient is very uncomfortable. He or she may not be able to tell you there's something wrong, and you're actually going to injure that tissue further. All right, so there's so many different ways you can hold the instrument. That's the tap one is a commonly used one. You can see that there's a groove where the person is holding the thumb. That's how you feel the adhesions underneath the skin. The bottom one is also, you can see that how it's curved according to the contour of the body. Frequency and dosage. A recommended dosage is around 90 seconds up to 5 minutes per area. You do not want to scrape or work on more than 5 minutes in an area because you can injure that area if you continue to do that. 2 per week is adequate. You can go up to 3 times a week. 3 to 4 weeks is the max usually we would see someone for IASTM. Most cases will see result in 2 to 3 visits. I had a lot of patients who had immediate results in barely 1 minute. Treatment variables. So the angle at which you do is around 30 to 45 degrees would be ideal. So I'm pretty much saying that you don't want to do something like this. That would not be good. So you have to be in an angle. It could be fast or slow. If you do fast, it's mainly to relax the muscle. And if you do slow and sustain, you can actually inhibit a muscle. So depth, very light to deep, depending upon where you're doing it. If you are around a bony area, you might want to be very light. If you are in a deep area like gluteus maximus or hamstring, you could go medium to deep, depending upon how much adhesion the person has. Vectors or directions, and that's something which you decide based on how the fascia is spread out. Okay, order of treatment. This is just a piece of the puzzle. This is not the solution for everything there's wrong. Manual therapy without movement will not be maintained. I don't know how many of you have attended Dr. Deepak Kumar's seminars. One of the things he teaches in that class, and I have attended that too, is mobilization with movement. This is a form of manual therapy. If you do just manual therapy without doing any exercise or movement, it's a complete waste of time. The tissue will go back to where it was before. So it's very important. Movement will not be maintained if there's no exercise to go with it. So reframe my approach as a heavy manual therapist. All right, scars. So the fascia binds down, causing movement restriction. So you have a scar the fascia underneath really start binding down, and it'll pretty much close down that joint. So you have to assess the vectors or glide. So you have to gently glide and see where you feel the restriction. Close your eyes and gently feel it. So like I said, the next time you go back to your clinic, take a spoon, if you don't have the instrument, gently try to glide across the screen, and you'll be surprised how much adhesions or bumps you might see, and start gently releasing them. And of course, you need a full training to do it the correct way, but just by doing that, you know how much fascia is involved in restrictions. All right, so you should always test the direction of restriction. So sometimes you might feel restrictions going up towards a scar. Sometimes it's more down, or sometimes it's more cross. So by doing gently gliding around, you would feel the restriction. You can treat with gliding into or away from it. Sometimes I have a scar, I treat on both sides of the scar. Clockwise, counterclockwise to the restriction. And you can also treat with nerve flossing and tissue glide. Right? So the response to the treatment. Patients should expect some bruising, which is normal. Now, what you see here is abnormal, and that should never happen. That means someone did not use, one, emollient, two, the direction was wrong, and the force was too blunt. So it's very commonly seen in a very light-skinned person, or Caucasian or white. You may not see much bruising in someone who's brown or black. The color makes a difference. So clinicians should educate the patient about possible skin discolorations, which should subside in a day or two. Caution with the amount of pressure, especially when treating the elderly with the frail skin. If you have someone who is 65 or 70, look for how thin their skin is. The skin can break down so fast, so you got to be careful. All right, so this is someone who had a posterolateral incision after a total hip replacement. And you can see that I'm using a Graston instrument, which is a little bit more pointy, and look where my index finger is. This is how I'm going to feel how the glide is going to work. Oh, looks like we have a little problem. Sorry about that. Yeah, sorry about the technical difficulties here. This is another instrument. It looks like a handlebar. It's actually a Graston instrument, which I'm actually releasing the IT band. Yeah. Sorry about all that. Okay. So what you saw in the video is releasing a scar, and that's someone who had a total hip replacement, probably I would say around 7-8 months back, and he's been having a lot of difficulty with abduction of the hip. So after the release, his range of motion significantly improved. So it took around 3 sessions, and his sensitivity around the scar also improved right after that. This is another video of one of my therapists doing a instrument-assisted soft tissue mobilization on a golfer's elbow. So what he's applying is an emollient, which actually makes the glide much smoother. Right? Let's move on to the next one. Okay. So this one is another application of how I'm using it on a wider area. So Brett here has a pretty tight back. So instrument-assisted soft tissue mobilization is a great technique to improve the fascial anatomy, fascial restriction, I mean. Now what, Alicia is a physical therapist, and what she's doing right now is a technique called scanning. She's scanning using one of the Graston instruments to find out where the adhesions are. So while scanning, she might find certain areas with more restrictions and certain areas with less restrictions. So based on this, she will decide which instrument to use and how to treat him. So that redness is a normal erythemic reaction. And someone with that light skin, this is pretty normal. And what I would tell is the patient can use something like Maalox. Using an emollient or some kind of very light cream. You don't want anything thick cream because the instrument has to glide smoothly. So this is a Graston #1. So this is called a Graston #1. This looks like a handlebar, but she's right now using this instrument to treat his adhesions. You can see that he's actually on a forward bend, a little bit of rotation to keep the tissue in a tight position. So this will be very easy for Alicia to treat her like that. Okay. All right. So moving on, what you're seeing here is a red sleeve. It's actually a neoprene sleeve and a rubber mix. So this is something which I use to treat nerve entrapments. So damage to or disease affecting the nerves, which may impair the sensation, movement, gland, or organ function, or other aspects of health, depending on the type of nerve affected. So let's take a look. So this is a common peroneal nerve, which could easily get trapped in this area. I'm pretty sure you may have listened to Dr. Kumar's seminar on this. So this is someone who had a lot of tingling and numbness, paresthesia from an entrapment. Let's watch a small video real quick. This is a great technique. The patient is able to tell you that they have tingling numbness right about here. So I'm gliding around the fibular head. Entrapment. The nerve is just like any other soft tissue. And using the belt, you can see that the patient's angle is in an inverted position. So this is a peroneal nerve glide. If you're doing the instrument-assisted mobilization with a sleeve like this, the nerve can tolerate that better. Go a little faster. Good. All right. So one of the things to be careful about here is you can never treat a nerve using a a sharp instrument. If you're using a sharp instrument to mobilize a nerve, it can actually cause irritation in the myelin sheath, making that paresthesia or the tingling and numbness even worse. The patient could be very angry with you. So this is why rock plates came out with a rubber sleeve, and Graston also has something similar. So you got to be careful. Don't just bluntly take a spoon and start working on the nerve. That would not be cool. So this was a very short introduction. I wish I had more time to explain all this to you. I hope this was helpful. And if you guys have any questions, and I would be happy to answer them. This is our team here. And I really appreciate this opportunity, and thank you again.